Hey y'all, it's your girl Sade Williams. I got something new for y'all. It is called Sex Talk Sundays. Sex Talk Sundays, okay? It is where I come to y'all with an STD. I'm going to explain the disease itself. I'm going to explain its signs and symptoms, how it's transmitted to others, because that's important, how it's diagnosed, and how to prevent it, and treatment, if any, okay? So the first thing, hot off the rip, like the baby said, I got herpes, okay, herp alert. And so herpes is known as herpes simplex virus, and it is categorized into two categories, HSV-1 and HSV-2. HSV-1 is known as the oral route. If you got a cold sore, okay, I'm sorry to tell you, but you got herpes. And HSV-2, which is usually anogenital, okay? Anogenital meaning through the rectum and or through, you know, the genitalium or the vaginal canal, okay? And so these two diseases are spread via sex, right? Be it a sexual encounter vaginally, anally, orally, kissing with saliva. That is how this disease is spread, okay? And for you to be diagnosed, usually doctor will draw like a lab work, like some blood work for you. There is a chance that there's a false positive sometimes, right? Or if you have an actual outbreak, then the lesion can be cultured and sent off to the lab, okay? And sometimes the symptoms of this could be like swollen ulcers in the vaginal or the genital area for the men, or on the penile shaft, burning, bumps, burning when you pee, or swollen inguinal lymph nodes. Those are the little bumps in the inguinal area, the little, I call them bumps, but they're not bumps. Prevention. Y'all, let your partner know, hey, I have had a positive herpes test, or I have had an outbreak. I just want to let you know. Secondly, avoidance of sex during the times of outbreaks. And you need to avoid it for 48 hours after the lesions have disappeared, okay? You need to wait 2 days until them lesions is gone before you interact with somebody. Thirdly, condoms, okay? Condoms, okay? Condoms, okay? You need condoms no matter what. Treatment for this is usually an antiviral, a cyclovir or valacyclovir, but there is no vaccine for herpes at this time, y'all. Please be careful, because sometimes you could be asymptomatic, meaning you have a positive test, but you've never had an outbreak, okay? So it is important that you give full disclosure to anybody who you're with that, hey, I'm positive, and let the person choose, y'all. Have a blessed Sunday.